two things I want us to just recap on. Number one, the whole point of interventions is not simply just to write the intervention. It is because I actually was fortunate enough to come to Virginia State University to help start the PhD health psychology program. Today, we will actually start with Christina's intervention, which she already submitted. As we started the program, we wanted something that would be holistic, that would allow us to move into the community, to take research and translate it into the field. And that's where we realized the behavioral and community health sciences PhD health psychology track was a perfect fit for Virginia State University.
The doctoral program is a health psychology program. It has two major tracks to it. There's a behavioral and community health sciences track, and there is a clinical health science track.
If we're focusing on the behavioral and community health sciences track, we want someone that actually wants to get heavily involved in research. If you're going to be the interns implementing tips, we're going to be at a point where you just raise your hand. But they want to take their research and go impact communities. Anything you have when you're doing substance abuse in general.
Virginia State University has an outstanding psychology department, and it's really growing.
So when you're in groups, if you're doing an internship at another site, wherever you're at, the one thing that's the primary focus when you work with the community, when you work with other students, is
our graduates are graduating and becoming certified in a very short time with regards to counseling.
Every time we ran a sister group, everyone wanted to be tested, so they actually started coming to our evening groups. And some of the general requirements for the program, grade GRE score, and at least a 3.0 or better in your academic performance from undergraduate programs, or a 3.5 or above if you come in with a master's degree.
But I would tell you that to get a degree from Virginia State University in psychology is going to prepare you for the world.
The purpose is to make sure we're actually implementing the interventions in the community.
Our relationship with Virginia State University's School of Psychology Health Doctoral Program started with the inception of the new PhD program for health psychology. And we have been working very close with that department.
I'm good, how are you?
They have assigned students to Minority Health Consortium to help to evaluate data for different programs. Minority Health Consortium conducts behavioral interventions. And a lot of times, being a small organization, we don't have the resources to be able to evaluate our own programs, so it'd be very costly. And so this is our testing room. The second area, as I was talking to you earlier, was that we're going to be providing syphilis testing for the inmates at Riverside Regional Jail.
Our goal is to make sure we are focused on mental, physical, social, and spiritual health.
This is a room where people are going to be receiving their test results. And so our relationship with Virginia State's health doctoral program has helped us to be able to get those programs evaluated. And we have what we call the condom distribution program called Project Strapped. This is the tuxedo, the condom here. Monitor for the processes. This is an area where people can come in off the street and they need to use a computer. And also has been able to help us to leverage additional funding for our organization. You're going to be the persons who are going to be educating your peers, right?
One of the things that we look for in students for the BCHS program is someone that not only wants to just come in and have an enriching academic experience, we also want them to want to give back to their communities.
And this is?
Jonathan Roberts.
Christina Denslinger.
The relationship between Virginia State and my office is that we take interns from Virginia State. We do everything in here for veterans, man, that they may need. And we work with them and try to groom them into what we do. And that's work with veterans, human services, mental health. Veterans will come to the transportation department and they get free rides to McGuire Hospital. And we try to expose them to the dynamics of the mental health field and what veterans go through. What we do here is outreach.
You get the applied experience in your training with agencies that are working directly with minority populations. And that will very much complement your training that you received in the in the classrooms.
Dr. Kimberly Boyd from Virginia State University Health Psychology Department comes to the Petersburg Freedom Support Center to ensure that her doctoral students are on target, to ensure that they are receiving the education and information that they need while they're on site, and to ensure that the relationship and partnership is something that can be sustainable.
They may be working right here today, tomorrow, because we want to, you know what I'm saying? No, we want to develop it.
Oh, okay.
Yeah, we want to develop.
Okay. On campus, we learn about research, interventions, statistics, evaluations, but we take what we've learned and apply it to help our communities.
Our program is second to none, and I tell you that coming to Virginia State University, you're going to be well prepared and ready to compete with the world when it comes to our psychology program.